Good morning, everyone. Today we're going to talk about the coronavirus and whether you need to be wrapped up like this guy here, or if you can be something more normal like this guy here, or somewhere in the middle. We're going to talk about infrared thermometers, non-contact. They're being used at many schools and government offices. We're going to talk about goggles and glasses. We're going to talk about gloves and, of course, surgical masks as well as N95 masks. Now let me start by saying I'm not a health professional, I'm not a scientist. This is just my interpretation and I'm going to show you what different people are doing. Not everyone has to wear masks, not everyone has to wear goggles, gloves. It really depends on your exposure. If you're exposed to a lot of people, be more careful. And I want to kind of answer a question in advance. Is this panic? Are people worried? This is just preemptive, taking steps just to try and make sure that you avoid it as much as possible. It's not panic, it's just preemptive steps. So one of the first things you'll notice is infrared non-contact thermometers being used to measure people's temperature before they enter certain government buildings or even some schools. For example, in Quezon City, they're screening students before they enter. They're even sanitizing their hands, which is a very good move. Another thing the MMDA are doing is distribution of face masks, especially for frontliners that have exposure to a lot of members of public. Another thing the MMDA have implemented is these new wash stations at entrances of their buildings so people can wash their hands and stay clean. That's really one of the biggest things right now, is cleanliness and sanitization. As for public transport, here you can see a train from the LRT Line 2 being sanitized and cleaned. And here's another thing some malls have implemented. Here at Mall of Asia, going up to the food hall where your hands really need to be clean, you'll see they've installed these hand sanitizers. These automatically sanitize the hand rail. So it's not your hand itself, but it's keeping the rail sanitized. So of course you should still wash your hands, but that's definitely a step in the right direction. Now at the moment, I think this is more of a trial or a test because these are not installed on all of the handrails, but they are on some of them. So what's happening essentially, from what I believe, is there's a UV light shining inside and the rail passes through it and it's cleaning it as it goes. I know it sounds obvious, but just want to explain just in case. So we're now here in PITX and I wanted to see what they've implemented in preparation. And actually it's perfect timing because they're doing a presentation to their staff right now about proper hand washing, how to look after yourselves, how to look after other people. They'll be doing a presentation with a projector. So it's good to know that PITX are also taking this seriously because this is a major commuter hub. They need to make sure that they keep this area perfect.
So that is coronavirus, animal to animal lang siya. So noong ngayong 2020, December 31, 2019, meron na siyang human. First detected siya sa Wuhan City.
Another thing you'll see an increase of in PITX is the hand sanitizer, and in fact you'll see this lady using it right now. So free for everyone, obviously. Same with this guy over here. So it's good to know that people are making use of this hand sanitizer. And likewise on the entrance they have hand sanitizer for everyone coming in. So if you see it, you can use it. You don't have to ask, it's free for everyone. As for commuters wearing masks, you'll see some are, some aren't. I guess at this point it's a personal preference, and you'll see the PITX staff themselves have surgical masks, and I believe some of them even have N95, but I think that's primarily for their medical workers who are more likely to have exposure, direct exposure with anyone that goes to their clinic. And we are now here at the Department of Health, so let's go inside and see what advice they can give us.
The best way to prevent infection, of course, is proper personal hygiene. So that is by washing your hands with using soap and water, or if that is not available, you can use alcohol or some other antiseptic. Usually we have these commercially available sanitizers, so these are available in the supermarkets. Our hands are one of the busiest parts of our body. We touch many things, so sometimes unconsciously we touch our face, our eyes, and mouth and nose. So potentially we may infect ourselves in case we touch something that is potentially harboring the virus or other microbes. If ever you cannot resist touching your face, wash your hands first with soap and water, or apply sanitizers or alcohol. And also, of course, you can boost your immune system by eating good food, nutritious food. Increase your intake of fluids and eat fruits, vegetables. So the natural foods are the best, you know? And of course, adequate sleep, good rest, so that you can rejuvenate yourself. You know? If you have an infection, a respiratory infection, so as to prevent infecting others, it would be wise to wear a mask so that you do not transmit or infect others. If there is a community infection, it would be advisable for the people in the community to wear masks. However, as of this date, there is no report yet of community infection. Therefore, it is not advisable for everyone to wear masks. There are people with morbidities who have low immune system. They are more vulnerable to infection. Therefore, it is recommended that they should be wearing masks.
So I'm now here at the Disaster Risk Reduction Management Building in Quezon City, and you see they have a huge LED billboard here giving information about coronavirus, about washing your hands and things like that, different health advisories. So let's go inside and see if we can get some more information about what Quezon City is doing. So the first thing we'll notice once we enter, of course, is disinfectant or sanitizer for your hands. So very important to have that.
It's been declared as an outbreak already, so immediately the Quezon City formed a task force on the novel coronavirus 2019. Yesterday, we had a general orientation with the 142 barangays of Quezon City, just to make sure that the updates of NCOV is being disseminated to the barangay captains. And what we're trying to do here is basically not to scare them, but we want to educate them in terms of what we should do and what else that is needed to be done. And the major objective is we remove the panic on the community. So part of those are also the training in proper donning of PPEs in any scenario that there's a need for our barangay health emergency response team would be transporting PUIs to Sentinel hospitals, then they would be capable of that. And our Mayor Joy Belmonte also made sure that all these PPEs will be given to all the health workers or frontliners of NCOV that's going to perform that. And our hospitals also as well would be equipped with these PPEs. And of course the DRMO is the frontliner in terms of transporting PUIs in hospitals. So last night we finalized the procurement of those PPEs. We're initially getting 3,000 PPEs for Quezon City to make sure that our frontline office or frontline responders are going to be safe and not going to be contracted by this virus. Then this morning we had an inspection with all the 3 hospitals, and we saw that all of the triage and isolation tents are in place for the 3 hospitals. So this would prevent also spreading of the virus in the hospitals. And we also make sure that the alcohols and proper disinfectants would be distributed to them as well, which was provided already by the Office of the City Mayor. In schools, we distributed masks for kids that's going to be suffering from colds or cough. We're not giving them a mask for everybody because it's not going to be needed anyway. So we just gave an ample amount. We started with 1,000 masks for them, and make sure that our information dissemination campaign on this would be regularly conducted. In case there's going to be an update, then we provide them through our Public Affairs and Information Service Department who's handling that. So they're all part of this task force that's working together. and also reporting directly to the mayor.
Somebody said about NCOV in East Avenue Hospital here in Quezon City.
Yeah, we immediately had called East Avenue yesterday when we saw that post in Facebook, and a lot of our netizens have been sending us those picture of the post. And again, just as expected, it's another fake news that was released online. So that's another thing that we want that we shared yesterday with our barangays, that even our barangay officials should not be or should be responsible in terms of announcing any NCOV related issues in Facebook or Instagram or any other social media, because it's gonna cause panic for our residents. And remember, only the DOH is the one that is mandated that can announce anything that's happening all over the country. So yeah, this is called the disease commodity package that we call. This is provided by the DOH for us initially. This is a sample of the kit that is being used. It's disposable. There are some surgical masks here, and we have here foot protector for just in case to cover your shoes, and we have gowns and 95 masks. So, and then this is the astronaut looking thing here. Is the coverall suit for our responders. It also comes with the goggles. Yes, this is a one-time use because you have to dispose it after. From head to toe suit that our responders are. It has a hood, so it's basically covering from your head down to your foot. We did the training on proper donning of PPEs with the help of our City Health Department, particularly the disease surveillance unit of the City Health, to teach our frontline responders in terms of wearing the personal protective equipment, that's PPE, and that is the one we showed earlier. That's the mask, of course, how to wear the proper suit, what's comes first and what comes last, and how you also remove it, and disinfect it and dispose it. So these are things that we need to know to make sure that our responders will be safe and not be contaminated by any of this virus. Then this is the picture of the transport of our two PUIs, allegedly PUIs or suspected PUIs from Diliman Doctors Medical Center to San Lazaro Hospital. However, when we touched down in the hospital, and the two Filipino patients did not board our ambulance and preferred to ride on their personal vehicle. So it was also the DOH in San Lazaro also triage officer also informed us along the way that they recommended that the couple would just go home and do the self quarantine for 14 days. Yeah, their complaint is a shoulder pain, and the only thing that triggered them to be flagged as PUIs is because of the travel history to China. So this one is among the initiatives of Quezon City. We have 3 government-owned hospitals. We have, this one is in Novaliches District Hospital, and they installed triage or isolation tents to make sure that before people coming in the emergency room would be properly screened first to ensure that the symptoms of the virus would not be contaminating existing patients inside the emergency room. Now, this is just for precautionary purposes, and except for those emergencies that they were talking about life and death situation, but just for symptoms of the virus, then we could do the triage. So it's like sorting patients here. Then this is the one in Rosario Maclang Bautista General Hospital. So this is how it looks. It's a 30-meter inflatable tents that is easy to set up. And this is the installed decontamination or disinfection area for our responders in somewhere in Pearl Drive. So this one is not inside a busy community. This is a safe open space for us to do decon. So these are the doctors in Quezon City General Hospital that also set up their triage tents and isolation tents for possible PUIs.
And this is the Quezon City Emergency Operations Center. So this is where they are handling some of those calls and where they're handling social media and information dissemination. Actually, it's so late. We've been on the road since 5 a.m. and it's now, I think, around 6 p.m. or 5:30 p.m. So it's been a very long day, but I think it's been worth it. And this is really interesting. They have ambulance monitoring, so they can GPS track every single ambulance assigned to the barangays. That's very good, because that will make sure that they're only used for the right purposes, and if something happens, well, it's easy to track it. So wow, that's really good.